Good morning, everyone. It's Josh at Prescription Fitness Physical Therapy and Sports Care, bright and early in the morning before we start our day. Again, trying to do a video every day for National Physical Therapy Month, which is October. So today's topic, I thought I'd go over: when do we put heat on something? When do we put cold on it? This is always controversy. Everyone has an opinion. It depends on who you ask. So my personal opinion. So if we have a structure that we know physically is tight, and remember from previous videos, tight does not always mean short, but in this case, and if tight is short, I'm going to apply heat to it. So heat increases pliability of tissues, it increases the nervous system's ability to transmit a neural impulse, so it helps to relax things. So we're going to use heat on a really tight, let's say a pectoral muscle that we're trying to stretch out because it's affecting our shoulder, affecting our head and neck position. Just kind of relax things, or maybe if we're going to put someone on traction where we want the traction to really have a good effect at separating the joints and relaxing the tissue, again, we're going to put heat on it. But that's about the only time. I'm a big ice guy. So why do we put ice on stuff? So if we look at what is the effect of ice, so number one, ice helps to create a decrease in cellular activity. So ice helps to slow oxygen or energy consumption. It just helps to slow sort of down the entire inflammatory process. So imagine if you're going to have a open heart surgery. First thing they do is they put a giant cooling blanket on you. So basically they drop the basal metabolic rate, which is the rate at which your tissues are using energy and oxygen, so that they can perform their work even longer without damaging the tissues. Or we all hear about the story where little kids walking across the ice pond, the ice breaks, and they go to the bottom of the pond and they fish them out an hour later, and lo and behold, there's no brain damage. That's because ice is slowing down cell metabolism. It's slowing down those things that cause damage and cell death. The other thing that it does is it changes neural conductivity. So, in the wintertime, if your hands and fingers are really cold, you try to button the button, it's super hard to do because we've slowed the rate at which the nerve can send an impulse to the muscle that's trying to supply. So, if that is our intended goal, that's a great thing to do. So we want to calm that system down. It helps to change circulation. So it helps to slow circulation into the system. Now there is a thing called Huntington's reflex where, they show this in seals where if they dive in deep, really cold water for a long period of time, eventually it actually causes an increase in circulation. But for the most part, it diminishes circulation. There might be an increase in localized superficial circulation. That's why the skin turns red, but for the most part, it slows that. It also changes tissue viscosity. So viscosity, thickness of the tissue. So if we want to, if the goal there again is to change that, we put ice in it, and it's going to slow it down. So it's going to make everything more difficult to sort of move and bend. Well, okay, maybe if I want to stretch something out, I don't want to do that. But maybe if I'm trying to stretch a knee that's swollen and inflamed, I want to calm down the inflammation, then I want to stretch it. So really, again, it depends on what our physiological purpose and goal is for using that particular modality. And of course, pain relief. Pain relief again goes to neural conductivity. So it slows the rate at which the brain is perceiving sensory input from the injured area, so that noxious stimuli is not getting to the brain as quickly. So you feel better, and that's an important thing. So we're huge on ice. We just ice everything. So ice is your best friend post-operatively. It reduces how much pain medication we need to take by a lot. So a lot of patients don't like to take pain medication. Put some ice to it. Super important. There's different ways to ice it. So, we'll talk about this in a future video, which is neurocryostimulation, which is super, super cool. Literally super cool. Ice packs, ice machines, machines that circulate cold water over a system repeatedly. So, heater ice. Again, my opinion, we're gonna ice down most things. So if it's painful in the first, let's say, 72 hours, never apply heat. I always apply ice, and again, I apply heat only when I'm trying to take a system and I'm trying to relax the nervous system, relax the person, or when I'm trying to increase tissue pliability because we want to stretch it out. So other people, they're going to disagree. Chinese acupuncture, I don't think they ever put ice on stuff. They don't. Everything gets heat. So everyone has an opinion. I guess you go with the opinion with the person whom you trust. So if your provider says ice, you should ice. If they say heat, you should heat. But there should always be a rationale. Just don't take it at face value. So that's today's video. And I'm Josh at Prescription Fitness, Physical Therapy, and Sports Care in Geneva.